So good morning. My name is Fatira Magla. I'm a second year BPT student. I'm going to explain you the bubonic plague caused by the positive organism Yersinia pestis. What is bubonic plague? So bubonic plague is one of the three clinical forms of plague caused by the Yersinia pestis. 1 to 7 days of the incubation period, causing the flu-like symptoms like including fever, headache, and hallmark symptoms is swollen, painful lymph nodes. Buboes, which is known as buboes, which is formed at the site of the bacterial entry. Acral necrosis, dark discoloration of the skin, which causes the gangrene and is a characteristic sign. And diagnosis is confirmed by the bacteria present in the sputum, body fluids, and the blood, etc. Now the mode of transmission. So flea bites from the infected rodents and or contact with the body fluids of the plague-infected animals. Progression risk. So can advance to septicemic and the pneumonic plague and organ damage with the high mortality. Now, Yersinia pestis, the causative organism. So it's a gram-negative Coccobacillus facultative anaerobe, which is a non-sporing spore-forming bacteria. Historical impact, causative agent of the plague of Justinian and the Black Death in the 6th and the 14th century respectively. Vector and transmission. Primary vector is Xenophila cheopis, which is oriental red flea. Pneumonic form spreads via the aerosol droplets. Discovery by the Alexander Yersin, Swiss-French physician at the Pasteur Institute in the Hong Kong. Now, why it is called as a Black Death? Because of the signs and symptoms it is following. So, physical manifestations, it causes like the dark purplish black patches in the pus-filled pubes, which is the enlarged lymph nodes, and the gangrenous tissue, which is present in the distal extremities and the nose and the lips, and the acral necrosis, which is the gangrene formed. And the Great Mortality and the Great Palestinian. The Black Death is believed to be the later mistranslation, yet it became the dominant historical designation. Now, range of systemic infections. So, when this bacteria, which is the Yersinia pestis bacteria, escapes the lymphatic systems, it disseminates to multiple organs systems, producing distant and often overlapping clinical syndromes of increasing severity. Hematologic and circulatory system. Now, septicemic plague. Bacteria multiply in the bloodstream, triggering the aggressive immune response and causing the disseminated intravascular coagulation, leading to the abnormal clotting and widespread internal bleeding, which is the internal hemorrhage and the gangrene of the extremities. Gastrointestinal system. High bacteremia loads frequently causes the acute gastrointestinal distress, leading to nausea, vomiting, and abdominal pain. Diarrhea is a secondary manifestation. Respiratory system, pneumonic plague. Systematic spread reaches to the lungs and causing the primary and secondary pneumonic plague. The most virulent, the contagious forms, which is mostly transmissible or it is transmitted through the aerosol droplets. Other respiratory droplets. Neurological symptoms, system. The plague meningitis. It's a rare cases, bacteria crosses the blood-brain barrier, infecting the meningitis which is surrounding the brain and the spinal cord, causing the meningeal plague and the severe form of the neurological colic. Now, the mechanism of action of the Yersinia pestis employs a sophisticated way of the virulence mechanisms to evade the host immunity and establish the systematic infection. So it is incubated by the flea bite first of all, and the bacterium exploits the several systems. So lymphatic invasion. Bacteria enters through the skin and travels via the lymphatics to the regional lymph nodes, where they multiply and causes the bubo, which is the enlarged lymph nodes, and which is also very swollen and very painful. Now immune evasion. Type 3 secretion. System injects YOP effector protein into the host immune cells and disabling the phagocytosis. So the macrophages and the mast cells are not able to phagocyte this organism, this bacteria, and suppressing the inflammatory signaling. Systemic dissemination. Bacteria breach lymph nodes barriers entering the bloodstreams, and septicemia, and potentially seeding the lungs and meninges and other organs. Now, signs and symptoms. So, systematic symptoms and the localized. Systematic, high fever exceeding the 39 degrees Celsius, chills and rigors, general malaise, general fatigue, and general weakness. Muscle cramps and body aches, and in severe cases, it causes the seizures also. Localized signs: painful lymph nodes, lymph gland swelling, commonly in the axilla, neck, and the griones, and pain may precede visible swelling at the infection site, gangrene of the extremities, toes, fingers, lips, and the nose, nasal tap. Epidemiology. According to the WHO, 1,000 to 3,000 cases annually, and mostly highest burden on the sub-Saharan African regions, particularly in the Madagascar, Democratic Republic of Congo, and Tanzania. And seasonal pattern. So this disease shows the seasonal patterns, which is peaked in the summer and the early autumn, and correlating with the increase in the flea and rodents activity, and most common in the rural and semi-urban places. Historical pandemics, which is the plague of Justinian, killed 20 to 50 million and the Black Death claimed 75 to 200 million lives in the Eurasia. 3,000 annual cases, according to the WHO, 75 million Black Deaths, and 15 endemic attacks. Prevention and treatments. Prevention strategies. Pest control and modern sanitation, and also the rodent and the flea control should be taken care. Rodenticides and pest insecticides should be used, and public health education, avoiding contact with the wild rodents and their fleas. Isolation of the pneumonic plague patients to prevent the airborne transmission. Now, antibiotic treatment includes the aminoglycosides, tetracycline, fluoroquinolones. Thank you.